Orthopedics is unique in the field of medicine in that our patients oftentimes get remarkably better, and you can make a big difference in somebody's life in a short period of time. When I was about 5 years old and had a hip condition, and my parents brought me to see Dr. Kelly. And so I had a long relationship with Dr. Kelly growing up and got to know Dr. Kelly as a physician and became family friends with him. And he's been a real mentor to me throughout the years. And so when it came to deciding a practice in Macon, Georgia, it was a pretty easy decision just because of my relationship with him. I do a general orthopedic practice, and part of that is sports-related injuries, whether it be high school or even younger, recreational, adolescent in baseball or soccer. And we see a fair amount of the kids come in with elbow and shoulder problems from throwing activities. Back when I was growing up in the 80s, we would play baseball in the spring, and then you start back and playing some football in the fall, and then basketball, and then start back baseball in the spring. What we're seeing now is a lot more specialization in children choosing one particular sport and playing it year-round. They're using muscles and joints to the extreme because certain sports require different amounts of running and jumping and throwing. And the thought was back 30 years ago that having a 3-month season and then going on to the next sport was actually beneficial to allow certain things to rest. Now, kids are playing sports year-round, and you never really give the joints and muscles time to recuperate. And so we're asking kids to do a lot more than we used to. And we try to limit their activities in hopes that when they become mature in their late teens to 20s, that they don't have lingering problems. And it appears that we can do that, but I think probably the jury's still out. The benefit of the arthroscopic procedure is that the recovery time is oftentimes a quarter to a third of what it would be if you were to actually open the joint up and recover. So a lot of procedures, we're seeing folks 2 to 3 weeks back to normal activity. And of course, it depends on what normal activity is for that patient. And shoulder procedures as well, that the recovery time is reduced fairly dramatically. If somebody has failed conservative treatment and have wound up needing some sort of surgical intervention, I feel it's important to describe the surgery in simple terms so that everybody understands what's going to happen to them, that any question they have is answered appropriately, and that there are no surprises after surgery. And it's been shown that folks that understand what's going to happen to them, understand the recovery process, what to expect at what point in their recovery process, tend to do better. They recover faster, there are no surprises, they know exactly what to expect. And there's actually a program at the hospitals in town where they go and they meet the people in the hospital that are going to take care of them. They kind of have a itinerary, if you will, of day 1, day 2, day 3 after surgery, and they have a pretty good idea of what to expect before going into all this. The patients do better. They're not wondering what in the world's going on. Why are you in here at 7 o'clock the next morning after surgery? Well, they're getting up, they're doing therapy, and they know to expect it. And we've seen better outcomes because of it. Initially, when I started 4 years ago, we saw very few workers' comp patients, and over the past year, we've really built up our workers' compensation practice. You have to keep the best interest of the patient, the worker, in mind, but you also need to get them well and get them back to work. And sometimes that's a fine line, but we are seeing more patients. We do our best to get folks rehabilitated, get them back on the job so they can become productive. We're very proud of our staff here, both the physicians and the employees. Everybody has a smile on their face, they're pleasant to deal with, and I think they're all in it for the same goal, which is to get folks better, to make their experience here a good experience.